Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
Today, we're going to be talking about how to get the best and right care at the right place at the right time here in St. Louis.
The healthcare system has become extremely complex, and access is not always open for everybody. A lot of times, there's so much demand right now that when you call, they may not have an appointment or space to see you for the next few weeks. So people really, once they hear that from their physician's office, they don't always know what to do next. And that's when it's important to know what's the next best step, whether it's to go to an emergency department or go to an urgent care, or can you wait a couple of days until an appointment opens and try again?
We'll be right back.
RareGem Productions, proudly presenting, promoting, and producing positive programs.
So Karen and Dr. Poirier, please, as your introduction, let's start off by asking you, what does it mean to you to be alive and well in STL?
For me personally, it means to be active in my community, to get out and play with my kids, to be healthy and happy, and being a part of where I live.
I'd also agree. Personally, we each have to answer that question for ourselves. And for me, it's getting a good sleep at night and being able to participate with the community, integrate, feel like you're making a difference. You also want to take advantage of what this great city has to offer, whether it's Forest Park, downtown, all the free educational opportunities we have available to us in the city, along with the museums, the arts, entertainment. There's so much that we can all take advantage of.
Alive and Well STL.
Good morning, St. Louis, and thank you for joining us today. I'm Bethany Johnson, CEO of the St. Louis Integrated Health Network and host of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today in studio, I am excited to be speaking with Dr. Robert Poirier, Chief of Clinical Operations in the Barnes Jewish Emergency Department, and Karen Bradshaw, Lead Community Referral Coordinator with the St. Louis Integrated Health Network. Dr. Poirier and Karen, thank you so much for joining me today.
Thank you.
Thank you for inviting us.
Dr. Poirier, while working with patients and working in the community, do you get the sense that people understand how to access care at the right time in the right way?
Not always. Some people do, but the healthcare system has become extremely complex, and access is not always open for everybody. If you have a primary care physician, you have a good relationship, and the primary care physician's not overloaded, when you call, you might be able to get in. But a lot of times, there's so much demand right now that when you call, they may not have an appointment or space to see you for the next few weeks. So people really, once they hear that from their physician's office, they don't always know what to do next. And that's when it's important to know what's the next best step, whether it's to go to an emergency department or go to an urgent care, or can you wait a couple of days until an appointment opens and try again?
So the way I understand it, healthcare really is in a continuum. There's primary care, there's specialty care, urgent care, and emergency care where people can go straight to the hospital. Can you help explain to me and to listeners what the difference is and when you should use each of these types of services?
It really depends on what's going on with you. Now, ideally, everybody has a primary care physician or a primary care home where they can go when they have a cough or a cold or to get their regular checkups to make sure if they need medication, they're on the correct medication and they're taking it in a way that's beneficial to them. If you develop, let's say, chest pain or shortness of breath or a really bad headache or weakness, or you develop an illness where all of a sudden your body feels very different, you need to then decide, okay, how serious is this? and where should I go next? And really, if you're having chest pain, you're having shortness of breath, you're having very bad abdominal pain, you can't hold down, you're vomiting a lot, you can't hold down any food or drink, and that's going on for a couple of days, you really need to probably be seen in the emergency department. If you have a bad trauma, if you have a bad accident, if you're bleeding or you have a bad cut, then you need to most likely come to the emergency department. So the emergency department's really for people that need to be looked at and treated within the next 1 to 2 days. And if they don't, they could get much worse. And the next area that people could go to are the urgent care centers. Now, urgent care centers really treat kind of more minor injuries and illnesses. If you break a bone and it's sticking out of your skin, you need to go to the emergency department. If you think you broke your bone, you twisted your ankle, going to an urgent care center where you can get a quick x-ray, get the diagnosis, and get the treatment you need, that's okay. If you have a little laceration or you have a little cut on your skin that may need a few stitches or maybe could be glued shut, that could go to an urgent care center. If you have an abscess that pops up and it needs to be drained and it's small and you don't have a bad fever or high fever, that could go to an urgent care center. It's hard to give people a description of every little thing that they need to know to go to an urgent care. But if you're okay and you feel like you have something that maybe you could wait a day or two or a couple of days and be okay with it, then that's kind of more an urgent care center problem. Although if it's nothing major, your first choice, and you have a primary care physician, is to go to the primary care doctor who knows you. And oftentimes they can help you decide, come into the office, or you should go to an urgent care center, or you should go to an emergency department.
Thank you, Dr. Poirier. Karen, as community referral coordinator at St. Mary's Hospital, you work with individuals who often don't have insurance or don't have enough insurance to pay for everything that they really need. What are some of the most frequent asked questions that you get when people visit the emergency room?
The patients that I work with are usually uninsured or underinsured, and I see them after they've already been examined and seen by a doctor. So their immediate concern for what they came for that day has at least been taken care of, or the start has. So what we concentrated on is working a plan for when they leave the hospital. How are they going to continue to take care of themselves? If they have a chronic condition like hypertension or diabetes, where are you going to get your regular medications from? So a lot of what my colleagues and I do is work with folks to come up with a plan. And there are a lot of assumptions that when people don't have insurance, there's nowhere for them to go. And a lot of what we do is educate patients and work with them to meet them where they are, to come up with a plan, link them to doctors who they can see outside of the hospital, and hopefully get on a path where they can care for themselves.
I imagine that you must come across a lot of people who have learned misinformation and are acting on that. What kind of myths would you like to dispel for the community that happen all the time, and really, if we just knew better, we would do better?
That's actually a phrase I use a lot. When we know better, we do better. I think one of the biggest ones that people have is that the emergency room is the best place to get care. It's not always the best place to get care. If you're having a heart attack, if you're having a stroke, if you've had an accident, yes, hands down, the best place to get care. If you're managing your diabetes, you're managing high blood pressure, you're managing other chronic conditions, it is not the best place to get care. If you're having a crisis, yes. But if it's just you're out of your medications, you know you have hypertension and you haven't treated it, that's not the place to go. You're not going to be able to follow up with that doctor. The prescription you get is only going to last 30 days and you're going to be right back to where you started before. The assumption that you go to the emergency room and they're going to take care of everything. Dr. Poirier, every emergency room physician is going to tell you they do not take care of everything. They take care of that moment. And having a primary care doctor or a primary care home and getting linked with doctors and nurse practitioners who can help plan longer and make you feel better and longer term is really the work that we do with folks as they leave the hospital.
But I don't want to wait, and it seems to me like it's free when I go to the emergency room. I get every need taken care of. Dr. Poirier addressed that because I hear that quite a bit.
Yes, most people do think it's free, although it's really not. To operate an emergency room, you have to keep the lights on 24/7. We're open every day, including holidays. And we're proud that we're able to be that resource to the community. But right now, as with the bad flu season that we're seeing that demand is higher than what we can provide. And so then we have to triage. We have to focus on the people that need us the most, the quickest. And then if you have something a little bit more minor, you have to wait. And even though it seems like the emergency department is free, really somebody has to pay for it in the end, and bills will be sent out. And the costs for the emergency department then are kind of pushed over to the people that can't pay all the time or don't have insurance. And if you don't turn in your financial forms showing what your income level is, you'll get a big bill. And if you don't pay it, it goes to collections, and that causes people problems as well. And so even though it seems like it can be free at times, it truly isn't. The government pays for it. Our taxes go up to pay for it. The insurance companies get charged more money to pay for it, which then your healthcare premiums when you're on a job somewhere go up. And so really everybody in the end ends up paying for it.
So I don't want a big bill. I know that I'm sick. I think I'm just going to stay home and wait it out. What's your reaction to that? What's your advice for that person?
I would say if it's a simple cold and you feel kind of like you did when you were a kid, or you're not very sick, you don't have a lot of bad symptoms, you could always go to your local pharmacy and get some over-the-counter medications, which are very cheap. Sometimes just a little bit of Mylanta or Maalox or Tylenol or chicken soup even. Ask Grandma what she recommended and what she uses. That's very useful. But if this is something unusual, you're having trouble breathing, you're having bad chest pain, you feel really bad, and it's not going away especially, then you need to get some help. That's when, if you have a medical home, that you call and say, look, I'm feeling this way, can you see me? And they'll either evaluate you by talking to you over the phone and tell you to come in to be seen in the next couple of days, or they'll say, no, your symptoms sound pretty bad, you should go to an urgent care or you should go to an emergency department. And so you really need, for the very minor things, especially the minor coughs and colds, if you wait long enough, they will get better over the next few days. If they're not getting better and they're getting worse, that's when you need to seek out treatment and care and help.
Karen, could some of the reasons people choose to go to the emergency room be treated in a different way?
Yes. I think a lot of it is many of us as adults have so many other commitments and responsibilities, work, family, children, that we often put off things that we know aren't right. People, especially, for example, hypertension. People know some of those symptoms, or it runs in their family, or they might suspect they have hypertension. It is always better to act and get set up with a primary care doctor when you're actually feeling well. As adults, a lot of us don't think about it until we're not feeling well. But if you can get set up with a doctor, then you have that resource when you're not feeling well. I see a lot of patients who come in and it is that crisis moment that their blood pressure was so high that they did need to seek services at the emergency room. But it's almost one of those visits that could have been prevented if they had had a regular checkup with a primary care doctor, had gotten on medications that really only cost $4 a month and would have prevented the whole experience for somebody.
The community health centers in our area are now offering urgent care services to be an alternative to emergency care in the city and the county. Now, when health center patients go in for urgent care, they can still be connected to their primary care homes, which really is our goal, is to get you back to your personal physician. What does continuity of care like this mean for patients?
I would say if you can go to an urgent care center that is connected to your medical home, that is ideal, because the information will be sent to your physician or clinician that's taking care of you. And the more information that your medical provider has, the better they're going to be able to care for you, especially in the long term. They'll get to know your body, understand your body, what's your symptoms when you're really sick, or when you have an illness that you'll get better from just by treating the symptoms. And so I think access to urgent care centers that are connected in some way to your medical home or can transmit the records or provide the information is a fantastic idea.
We've got good news in the region. Most recently, we know that there are new access points for urgent care. So Myrtle Hilliard Davis Comprehensive Health Center will be offering urgent care at their Martin Luther King site. Grace Hill's providing urgent care at their Soulard Benton site, and urgent care will be available at SSM Brentwood facility. So I think that's going to be helpful in our region. Karen, I'm going to toss you almost our final question. If we find ourselves or a loved one having to come to the hospital to get help, What tips do you have for us to make the best of that visit?
I actually think and support patients in the hospital to have someone with them. When you're a patient and you're not feeling well, you miss half of what the information is. And I don't even know if that's scientific, but a lot of information goes right by you and you can't hear it all. You're feeling ill. If there's somebody else there that can hear those instructions, or there's a change in medication, or you get a new prescription, learning how to follow up, those types of things. I think it's always helpful to have someone else listen with you. And sometimes when I meet with someone, if they're really ill, I might even ask for their permission to give someone a call to help transfer that information when they're at the hospital, because I don't remember things if I'm not feeling well either. I think when you go to an emergency room, if you do take regular medications, even if you bring the bottles with you, because ED doctors cannot know your history, cannot know everything that you're on. And it's hard to remember all those complicated names. Bring them with you. Bring the name of your primary care doctor or the health center that you go to. The more that you know as a patient is the more that you can provide those of us who see you in a hospital plan for when you leave.
So wrap-up question for both of you. What are some specific things that our listeners can do today to prevent a trip to the hospital by living healthy?
I would say knowing your body and taking care of your health, paying attention to it. So eating healthy, getting good sleep at night, trying to reduce the stress in your life. We all have a lot of stress at times, but trying to reduce it as best you can. Finding a hobby that you really like, staying connected to your community and to your neighbors. Really, it's the human contact and touch that we have that's so important in our lives. You need to make sure that you eat healthy. If you drink alcohol, make sure it's in moderation, that you don't drink too much. Stay away from drugs unless they've been prescribed to you. So those are some of the things. And get exercise, even if it's only 15 or 20 minutes a day, whether it's a walk around the block or a walk through your house several times, climb up and down the stairs a few times a day. That's all very important and keeps your body in good shape.
My advice in addition to all of that would be plan ahead. If you don't have a primary care doctor, get one while you're healthy. Do it instead of waiting for that crisis moment or when you're not well. It's a lot easier to get those things established and have a conversation with someone to become your doctor while you're feeling well.
Practice prevention. Well, Dr. Poirier, Karen, thank you for joining us today and for the work that you do and continue to do in the St. Louis community. And for more information, St. Louis, about accessing the continuum of healthcare services available to you through the St. Louis Integrated Health Network, please visit us online at aliveandwellstl.com. Thank you so much.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.